Okay, so you can start your seminar now, but you turn on your video. Your video is off.
Ma'am,
Mm-hmm.
ma'am, share screen.
Share screen. Oh, ঠিক আছে। পাৰিব চাই লোৱা।
Oh, ma'am. Hello, ma'am.
Mm-hmm.
Ma'am,
দেখা পাই আছে।
visible?
Yeah, it is visible.
Good afternoon, ma'am, and my friends. Today, my name is Ms. Rashmi Sunal, DDIT second sem, and my topic is monitoring patient during dialysis, nursing care of patient on dialysis, sanitizing machine, dressing, treatment, flushing new PD catheter. PD catheter is a special tube that is injected into your abdomen cavity. When the catheter is in position, a small amount of fluid will be flushed to it to check it is in to correct place. PET. Peritoneal equilibrium test. It is a semi-quantized essential to peritoneal membrane transport function to patients on peritoneal dialysis. Peritoneal care. Peritoneal requires promote medical attention to flight infection and, if necessary, to treat any underlying medical condition. Peritoneal treatment usually involves antibiotics and, in some cases, surgery. Next is vaccination. Dialysis requires 5 things: access to patient circulation, access to dialysis machine and dialyzer with a semi-permeable membrane. Semi-permeable membrane is a membrane that only allows movement to solvent molecules, but movement of solution particles access the membrane. Next is the appropriate solution time: 12 hours each week, divided into 3 equal segments. Place, home, and dialysis center. Dialysis procedure. Patient circulation is accessed. Dialysis solution surrounds the membrane and flow to the opposite direction. Number one, highly purified water. Number B, nitrogen, nitrogen, potassium, calcium, magnesium, and chloride and dextrose. Salt. Second is salt waste can be discarded. Ultrafiltration remove excess water from the body. Excess, excess during dialysis. Infection, catheter clotting, central thrombosis, development of an aneurysm, stenoid blood in the urine. Pre-dialysis care. Weight. Determine amount of fluid to be removed during dialysis. Vital sign. BP of hypo and hypertension, temperature, respiratory system. Potassium level. Determine potassium level in dialysis. Whole antihypertensive drugs. It A type of drugs used to treat high blood pressure. During dialysis, hypertension, muscular cramps, nausea and vomiting, headache, itching. Post-dialysis care. Monitor BP, report hypertension or hypertension, hypotension and hypertension. Watch for bleeding, check weight and compare. Weight loss could be close to fluid remove goal set during treatment. Give mesh meat if indicated. Means if necessary, then you should give medicine. Nursing intravenous in dialysis. Assess the patient condition. Teach patient how to peritoneal dialysis or hemodialysis is in home setting. Consider the patient learning, need the provide education about their treatment, make a training plan for each other. Ma'am, hello ma'am. Hello, ma'am.
Finish.
Yes, ma'am.
You are just reading or you are explaining or not? Some of the students have joined just now. Okay, so you start from the beginning. Arab, one more time you repeat the class.
Okay, ma'am. Nursing care of patient on dialysis, sanitizing machine, dressing treatment, passing new PD catheter. PD catheter is a special tube that is inserted into your abdominal cavity. When the catheter is in position, a small amount of fluid will be flushed through it to check it is in the correct place. PET, peritoneal equilibration test. It is a semi-quantitative assessment of peritoneal membrane transport function in patients on peritoneal dialysis. Peritonist care. Peritonist requires promote medical attention to fight the infection and, if necessary, to treat any underlying medical condition. Peritonist treatment usually removes antibiotics and, in some cases, surgery. Next is vaccination. Dialysis requires five things: access to patient circulation, access to a dialysis machine and dialyzer with a semi-permeable membrane. Semi-permeable membrane is a membrane that only allows movement to solvent molecules but restricts movement of salt particles across the membrane. Next is the appropriate solution. Time 12 hours each week divided in 3 equal segments. Place, home and dialysis center. Dialysis procedure. Patient circulation is access. Dialysis solution surround the membrane and flow in the opposite direction. Number 1, highly purified water. Number B is sodium, potassium, calcium, magnesium chloride, and dextrose. Solute wastage can be discarded. Ultrafiltration removes excess water from our body. Access during dialysis, infection, catheter clotting, means जो blockage. Center venous thrombosis. Center venous thrombosis occurs when a blood clot forms in our brain venous sinuses. Next is development of an aneurysm. Development of an aneurysm is start to develop one side of the peritoneal wall. Stenosis. It commonly occurs in the neck and lower back. Pre-dialysis care. Access for weight. Determine amount of fluid to remove during dialysis. Vitals in BP of hypo or hypertension. Temperature. Respiratory system. Potassium level. Determines potassium level in dialysis. Whole antihypertensive drugs. A type of drug used to treat high blood pressure. During dialysis, hypertension, muscle cramps, nausea and vomiting, headache, itching. Post-dialysis care, monitor BP, report hypertension or hypotension. Watch for bleeding, check weight and compare weight loss should be close to fluid remove goal set during treatment. Give meds if indicated. If it's necessary, then you should give a medicine. Nursing interveners in dialysis. Assess the patient condition. Teach patient how to peritoneal dialysis or hemodialysis in the home setting. Consider the patient learning needs and provide education about their treatment. Make a turning plan of each other. Ma'am.
Okay. You ask them if they have any doubt regarding the topic.
Anyone have any question?
If no, then you can ask them the questions.
Okay, ma'am. Vishal Kalita.
Yes.
Turn off your screen.
Okay, ma'am. Vishal Kalita.
Yes.
What is excess during dialysis?
Blood, blood and urine test. Blood and urine test and infection.
Thank you, Vishal. Krishna Rajbangshi. Hello, Krishna.
Yes.
What is access for pre-dialysis
Yes.
care?
Weight, vital signs, potassium level, hypertensive drug.
Okay, thank you, Krishna. Senghamsi. Hello, Senghamsi. Reception. Divyajit Saikya. Hello. What is the solution of dialysis?
Solutions are sodium, potassium, calcium, magnesium.
Okay, thank you. Jem Nunu.
Yes.
Hello.
Yes.
Give me 2 nursing care of patients in dialysis. Hello.
Yes.
Give me 2 nursing care of patient on dialysis.
Assess the patient's condition.
No. Give 2 nursing care.
I don't know.
Okay. Tumbe.
Yes,
Tumbe
Rasmi. Yes, Rasmi.
give 2 nursing care of patient on dialysis.
Vaccination and dressings and treatment.
Okay, thank you, Tumbe.
Thank you.
Malvina,
Yes.
give 2 requests of dialysis.
Access to patient circulation, the appropriate solution.
Okay, thank you. Darsana. Hello, Darsana. There's a reception. Hello, Surajit.
Yes. Yes, yes.
Full form of PET.
Peritoneal equilibration.
Hatulika. Hello, Hatulika. Hatulika is absent. Pablo.
Yes.
What is access for pre-dialysis care?
Gathering catheter clotting and stenosis.
Okay, thank you. Ma'am. Hello, ma'am. Ma'am.
Yes.
Hello, ma'am. Done.
Finish. Okay.
Yes, ma'am.
See, we're only reading, Rashmi. You weren't explaining anything.
No, ma'am. I explained.
Very less. Okay, whatever it is, but try it more better next time. Okay.
Okay, ma'am.
Other things it was good. Your slides and all were all good, but there was no picture. That is your topic was on how to take patient care on dialysis. So you could have just kept some pictures regarding dialysis or some nursing stuff, assisting a dialysis patient. Can you give me like you can just put some
নহয়
pictures.
ma'am, মই পিকচাৰবোৰ লাষ্টলৈ দিছিলো।
Last দিছিলা নেকি?
4খনমান পিকচাৰ মই দি দিছিলো।
চাও এবাৰ চাও।
Okay, ma'am. মেম দেখিছেনে?
Oh, okay. Okay then. ঠিক আছে দিয়া। Okay.
Thank you, ma'am.
Okay. Okay then. You please stop your screen share.
Okay, ma'am.
Tomorrow who has got the seminar?
More se.
Kun Vishal. What topic? What topic? Topic? Huh? কি কৈ আছা? কালি যদি তোমাৰ নেটৱৰ্ক যদি বেয়া হয় কাইলৈ অকমান চাই ল'বা ঠিক আছে অকমান ভাল নেটৱৰ্ক চাইডত যোৱা নহলে কেনেকৈ দিবা তুমি চেমিনাৰটো এবাৰে হয় কিবা অকমান কষ্ট কৰি লোৱা নহলে ৱাইফাই চাইডত যদি আছে লৈ লোৱা
Ma'am, kali more chronic kidney disease topic.
কিডনি ডিজিজ আচ্ছা ঠিক আছে হ'ব দে ঠিক আছে ভালকে দিবা ওকে
Okay, ma'am.
Okay then. You will give your attendance to your CR. Okay. Thank you.
Thank you, ma'am.